Depression consists of several subtypes and can be comorbid with catatonic depression, atypical depression, psychotic depression, persistent depressive disorder, seasonal affective disorder, and bipolar disorder. Major depression is a disorder involving a sad mood or anhedonia plus 4 or more or the following symptoms for at least 2 weeks. Some of the symptoms that may interfere with one's daily functionings are depressed mood most of the day, uninterested in everyday activities, significant weight loss, fatigue, feelings of worthlessness, can't concentrate, thoughts of suicide, slow movement, and insomnia. Research has shown that when using meta-analysis to see if scores differentiated when looking at taking medication versus the placebo, those taking medication with severe cases of depressive symptoms benefit from the medication more than they did the placebo. Oftentimes, patients are given selective serotonin reuptake inhibitors, or SSRIs, to treat their depression, while also participating in cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, is a form of psychotherapy that treats problems and boosts happiness by modifying dysfunctional emotions, behaviors, and thoughts. CBT focuses on solutions, encouraging patients to challenge distorted cognitions and change destructive patterns of behavior. The combination of these two treatment methods have proven to be very effective when treating depression. Hi, Dr. Azarad. Thank you so much for agreeing to speak with me about my topic, and then we'll get right into the interview.
Sure. So my name is Layla Azrabad. I am a associate professor of psychology here, and I'm a licensed clinical psychologist.
I'm Sharon Gilbert, and I'm an adjunct at North Central, and I also teach at Elmhurst too. And I'm also a psychotherapist. I have a practice in Naperville.
So how do we assess someone who we think has depression? So we've talked about this in our class, right? That the primary way that we do mental health assessment is by patient self-report. There is no medical test to diagnose depression. And so we ask the person to describe their symptoms, how they've been feeling, how it's been affecting them, how long it's been going on. And if the patient is a child, then certainly we will interview the child's parents, we'll talk to teachers, and we use that interview information in combination with some testing. So we might also have people fill out some standardized questionnaires about depression. We might give them some personality testing, and we put all that information together, and typically what you see happen is that everything's kind of pointing in the same direction, which is great. So if we do end up diagnosing depression, you asked how do we treat? So I think that answer depends on the severity of the depression and the patient. So in more severe cases of depression, we definitely recommend medication in addition to therapy, so combination treatment. If someone is suicidal, we will absolutely recommend medication. If someone's not functioning, not getting out of bed, we will absolutely recommend medication in addition to therapy. The research has found that a combination of therapy and medication works really, really well, especially for someone that's more on the severe end of the spectrum. For mild depression, it's really interesting. For mild depression, we found that physical activity, regular exercise, moderate physical activity a few times a week, just that in and of itself has been found to be as effective as antidepressant in treating depression. Therapy in and of itself is just as effective, and in some cases more effective in the long term than antidepressants in treating depression in people that have mild depression. So I think it depends. The treatment's going to depend.
There's certain key questions that we always ask to diagnose. Look for changes in appetite, changes in sleep. It's one of my coworkers. Changes in level of activity. Do they still enjoy things? Things like that. I would typically also have them fill out a Beck depression inventory, which is a very quick, very reliable, valid assessment measure to see if they have the signs. It's criterion validity for all the things we use to measure depression. So I would have them do that and see what score they got on that. And then just talk to them about what's happening. Typically, they're referred to me from someone, so if it's a physician, the physician might have already given me some information about what they were seeing or medicine that they would put them on. And then you said how was it treated?
How would you treat it? Yeah.
Very commonly with cognitive behavioral therapy.
Okay.
It is well documented, well researched that it's the one of the most effective methods for treating depression. There are other methods, and if someone really wants to use something else, we can do something else. But typically, start with cognitive and go from there.
Yeah, sure. So, I mean, certainly counseling is
Right.
one, and there's lots of different kinds of counseling, as we've talked about. Cognitive behavioral therapy has been found to have really good success for depression. It's a style of therapy that gets people to change how they think, but also gets them to change their behaviors and get out there and be more active. Interpersonal therapy is another therapy that's been found to be very effective, focuses on people's relationships. So you have counseling, you have other things like physical activity. Okay, so counseling we talked about. Exercise or physical activity is an important component of any depression treatment because it gets those endorphins going,
Right.
boosts mood and boosts energy. For severe depression, electroconvulsive therapy, ECT, is used, and it's kind of a last resort, but it's essentially where you take people in and they receive mild electrical shocks to the brain. And 7 out of 10 patients with severe depression will experience a drastic improvement. And again, this is for severe depression and people that have
Right.
not responded to multiple medications, lots of therapy. So there's that option as well.
Yeah, and I'm not a physician, so I can't give medical advice, so I can't say if someone should take medication or not. Because some people don't want to, some people don't respond to it. Yeah, so that's a whole different thing. What I do with a client, I would do regardless of whether they were taking medicine or not, because I have no control over that piece of it. But typically we will look at behavioral things they're doing. So certainly emphasize getting more physical activity, getting more exercise. Fresh air and sunshine really does help. Having a good support network, having a nutritious eating plan, and eating steadily throughout the day, not like a lot, but just to keep their blood sugar level at an even pace throughout the day, because when it if it spikes, like from eating simple carbs and an empty stomach, that could trigger a panic attack, and if it drops, then the mood tends to drop. So trying to keep it at a nice even level all day. Getting up and moving is very, very important. Sleep hygiene, we look at that. Depression affects sleep, and then sleep affects depression. So once that cycle starts going, it's really important to break it and address what's happening with their sleep. I would never say lack of sleep causes depression, but it is a major factor in how someone's depression goes.
Yeah, I think it depends. I think that people who have mild depression can be just as successful going through counseling and not taking medication, and the research supports that. But the patient's beliefs have a lot to do with it, right? Because if you have a patient that believes, if I don't take medication, I'm not going to get better, even though I think that they will, that expectation is, if they don't get medication, that expectation is going to prevent them probably from getting better.
Right.
You know, I mean, we come to self-fulfilling prophecy. We come to become what we believe is going to happen. And so I think that's why we have to take into consideration the patient's beliefs and expectations, because I could be giving you the best therapy, but if you don't trust me or if you don't think it's going to work, it's probably not going to work.
Right.
You know, so I think that, I think that in many cases someone can get better without medication, but if they think that they need the medication to get better,
Right.
I'm going to be fighting an uphill battle.
Okay.
It's not a matter of take meds or do therapy, or take meds or try behavioral. When meds are indicated, which again is not my call, when meds are indicated, people do the best when they take their meds and they do the behavioral methods, the cognitive and
Okay.
behavioral methods. If someone is dead set against taking meds, because I've seen that, they can manage their depression. They can get back to a normal way of living just from the cognitive and behavioral methods. But if they really, really need meds, it's much harder to do it without. They can, but it's harder to do it without.
Absolutely. I mean, antidepressants they boost mood, they
Right.
boost energy, they improve sleep. For a lot of people, they stimulate appetite, which is good because the depression has probably reversed all of those
Right.
things. So absolutely, they can improve somebody's quality of life, and they do. And we all know people that benefit from them. So I'm not saying that they don't work. They do work. I just think that it's interesting that for milder depression, other things also work.
Right.
You know, and so it's not the only option.
Right.
For the more severe end of the spectrum, it's a very good option in combination with therapy. So absolutely, I mean, they can make a really big difference. I've seen patients, we all have, there's studies indicating that people report really getting their life back. So absolutely, there can be a lot of benefit if someone can find the right medication at the right
Right.
dosage, yes.
Most of the SSRIs have negative sexual side effects.
Okay.
Lack of desire in women and lack of ability to maintain an erection in men. So some of the atypical, like Wellbutrin, I think, does not do that. And we're always making new drugs, so I'm sure that'll be the next thing. The makers of Viagra actually came out with an antidepressant first, and then they saw the side effect, and then they came up with Viagra.
Okay.
Yeah, that's how that drug was invented. So they don't help sex. But if someone feels better overall, they are more likely to want to engage
Okay.
in their life, in social relationships, in activities. That's why I'm saying if the depression is bad enough, all the behavioral methods in the world aren't going to
Right.
help. You're just not going to be able to get in there if you know they really, really need the meds to get things kick-started. So yeah, that's what a doctor has to determine.
Okay. As we can see, there is no one right way to treat depression. Several approaches, such as taking antidepressants, changing one's lifestyle, psychotherapy, and social factors, can all contribute into treating depression. However, contrary to all the different types of methods, pairing together taking medication and going through therapy are the proper methods to treat depression. While it ultimately depends on the patient and their willingness to work with their therapist to find what's best for them, there can be a solution to improve their daily lives. In addition to that, new medications are constantly being produced, and new approaches are developing in therapy, as well as continuous research being done. Therefore, it is important to assess each case properly to give the right treatment for those diagnosed.